Good morning, guys. Welcome once again to my channel, and this is the second part of what we did the other day, and then that was on immobilization device, and then specifically on cast. Today we are going to look at some few MCQ on cast, their answers and rationales. So let's start the day with it. So let's look at our first question, which is under neurovascular assessment. So the question goes: the nurse is performing a routine assessment on a client with a new fiberglass cast on the right forearm. Which of the following is the earliest and most important indicator of potential neurovascular compromise? So we have our first option being the right hand is cooler to touch than the left hand. Client reports a pin and needle sensation in the fingers. And then C, capillary refill in the right fingertip is slightly prolonged at 3 seconds. Then we have the last option being the client reports severe unrelenting pain that is unrelieved by prescribed pain medication. So we have our answer being D, because per or in reference to the previous presentation when we listed the 6 P's, which are the signs of compartment syndrome, we realize that pain is the first in the list over there, and then pain that is not proportionate to the usual pain of the casted limb and is not relieved by analgesia or an increased need of analgesia to relieve that kind of pain is the first sign of compartment syndrome. So comparing it to the rest of the option over there, pain stands as the main answer. Meanwhile, the rest of the points are correct, but they are not the earliest sign, but they are the late signs. Let's try the next question, which is on cast care instruction, and then you have to select order apply. So the question goes: which instruction is essential for the nurse to include in the discharge teaching plan for a client with a new plaster cast on the lower leg? You have to select orders apply. Keep the cast clean and dry. Allow cast 24 to 72 hours to dry completely. Expect some mild tingling and numbness for the first or 2 days. Then use a hair dryer on a cool setting to help relieve itching. Insert a soft padded object like a ruler under the cast to scratch the skin. Then 6. Elevate the affected limb above heart level continuously for the first 24 to 48 hours to reduce swelling. So we have our answers to be 1, 2, 4, and 6, where 1 and 2 has to do keeping the cast dry, and then which is a crucial way to maintain its integrity. Plaster cast can take up to 72 hours to dry as well. So blowing cool air into the cast is a safe method to alleviate itching as well. Then we have the 6 being elevation to reduce swelling, which is also correct. The rest are incorrect because the tingling and the numbness is just a sign of the compartment syndrome, which is paresthesia. This is a potential late sign of compartment syndrome, as I said earlier. Then the 5th point, which has to be something you have to avoid, which is inserting something under the cast, which could actually lead to a break in the skin integrity and then predispose you to infection in the later part. So let's have our next question. So this has to do with the warning signs. A mother calls the clinic because her child, who was casted yesterday for a fractured arm, has fingers that are pale and cold, and that have to do with pallor and then poikilothymia. And she cannot feel a pulse in the wrist, which is pulselessness. The nurse should instruct mother to take which action immediately. So we have bring the child to the clinic tomorrow morning for a recheck. That's late. Apply a warm compress to the finger and recheck it 30 minutes. That's also late. Administer prescribed pain medication and elevate the arm higher on pillows. When we have go to the nearest emergency department immediately or call emergency service. And our answer is D, because pale and cold extremities are just one of the late signs of compartment syndrome and it's a surgical emergency. So we have to do something about it rapidly. So let's have our next question. So the next question has to do with relieving cast itching. Relieving cast itching. So we have a client with a long leg cast, complains of severe itching under the cast. Which instruction should the nurse provide? So use a thin ruler to scratch the area gently. Blow cool air from a hair dryer into the cast. Apply a small amount of lotion or powder down the cast. Pour a small amount of rubbing alcohol into the cast. So we have our answer. So the answer is B. And then rationale against the other answers, where when you insect an object, break the skin integrity, and then lotion, and then the rest are not also correct as well. They are all going to risk you to skin integrity breakdown. Okay, let's move to the next question, which is the last. So we have cast removal teaching. So we have a nurse who is preparing a pediatric patient for cast removal. Which statement by the nurse is accurate? So we have A, the cast cutter will feel like a sharp knife. The machine makes a loud noise and will vibrate against your skin. We have you will need to be sedated because it's a very painful procedure or process. Then D, we will soak the cast in hot water for an hour before cutting it. So we have our answer being B, because the cast cutter use vibrations rather than rotating blades. They are loud and can cause pressure, but gently do not cut the skin. Okay, that's our last question in this presentation, and hope to see you next time. The end.